Katie, I'm going to actually show you the screening process that we're going to be doing today, and it goes from healthy all the way down to advanced disease. And why the x-rays that we just got finished taking are so important is we can actually see the bone surrounding the tooth. Can you see that there? And so if you follow this bone height over time, you can actually see it dropping all the way down there.
Wow.
So that's really what I want you to understand. So silent disease, this actually happens without you even knowing, kind of like high blood pressure or even diabetes. Until we actually measure, you may not even know that you're losing bone. So in the first category, in a healthy state, we actually take our instrument and it's measured by millimeters. We know that anywhere between 1 to 3 millimeters is considered healthy. So this white portion that you see here, that's what you see right here. Where that enamel ends, there's a little bit of tissue, and then underneath is the bone. So what we're really doing is we're measuring the height of that bone. So we'll get numbers between 1 to 3 on our ruler. There won't be any bleeding, and we can actually see the bone coming straight across here. Can you see that?
Mm-hmm.
Great. The first sign of an infection is actually bleeding gums. We call that gingivitis, and it's a bacterial infection. So when we take our ruler, we'll drop in here. We still get numbers typically from 1 to 3, but when we touch this tissue, there's going to be a lot of infection, a lot of bleeding. The good news is that the bone is not really disrupted at this point. It's not infected, so it's still going straight across here. As we advance into periodontal disease, you can see here our numbers are going to be between 3 to 4 millimeters, so we'll drop down farther with our ruler. And now this infection is not only in the tissue causing bleeding, but it's started to deteriorate the bone. So when we touch the tissue, we'll get bleeding. And if you look here closely at that bone, it actually looks like a little mouse or something ate away at the bone. It's very jagged. And that's actually what the bacteria is doing. It's deteriorating the bone in there. In a moderate category, our numbers are now deeper, usually between 4 to 6. So I say the average is about 5, and that's what you'll see here. Our ruler drops down a significant amount. Lots of infection has eradicated this bone, and if you just touch this tissue here, we'll get lots of bleeding, some swelling. But most importantly, on the X-ray, we can actually see the bone dropping right around that too. In an advanced stage, we're now up to 6 millimeters or greater. So quite a bit of bone loss here, lots of infection in both the tissue and the bone. And you can see in this photo that they've lost over half their bone. So not all our patients look like this. There's some 1970s dentistry, old dentistry going on. The typical patient actually comes in looking more up in these 3 stages. They've been going and getting their teeth cleaned, and so they've been having the outer portion of their teeth cleaned. But like I said earlier, any one of these infections is fairly silent. You might not even know that you have bone loss until we take our ruler and measure that. So typically, people can have that and not realize that it's occurring. So today I'd like you to listen for the first sign of infection, any bleeding, and then if we do have numbers of 4, 5, or 6. Any questions about this?